Thanks for tuning in. I'm Alycin Bektesh. This is one of the discussions that we are going to have about the 4 referenda that voters will see on their ballots this election season. Today we're discussing Pitkin County Ballot Measure 1A, Dedicated Property Tax for Healthy Community Fund. I'm here with Rachel Richards, who's a Pitkin County Commissioner, and Steve Wickes, who serves on the Citizens Review Committee for the Healthy Community Fund. The grassroots production of this discussion is made possible by the Thrift Shop of Aspen. Thank you both for joining me today.
Thank you for having us.
Thank you.
Rachel, this is the first local ballot initiative that people will see on their ballots this fall. It is very long and very kind of government speak when you talk about a tax like this. In the simplest terms, can you just start by explaining what the measure is asking? What does a yes vote mean? What does a no vote mean?
Okay, thank you so much for the question. And it is a crowded ballot this year. You need to get through all your state questions and state issues and state candidates first before coming to your local measures. Pitkin County formed a Healthy Community Fund originally in 2002 after the Great Recession, when the funding for a number of critical programs in our community just wasn't there with the tourism drop-off after 9/11. And this funds our senior center in a major way. That's one of our largest contributors other than federal funds, which are always a little questionable, and our community health services, which offer STD testing, treatment, family planning, so on and so forth. If you vote yes, you will be reauthorizing this fund for 9 more years. If it is not reauthorized, it expires and it goes away in its entirety. So it is really kind of on the cusp of community reauthorization.
It expires this year?
It expires this year, exactly. So the authorization goes away, and we are asking the public to renew that fund with a small increase. The total tax will be just under $1 million. For that property, and it is distributed also through about 70 nonprofits throughout our community that help make up that network of care, everything from visiting nurses and families with young babies to, again, hospice care for those of our community members who are suffering, and those families like that.
Rachel, this isn't just asking to re-up this tax, it's asking for more. So do we not have enough money?
Thank you for that question. It is a small increase that's being asked for this fund, and a variety of reasons for that. Last time, 6 years ago, we kind of under-asked based on what we knew we needed and also to have a full board support to go forward on the ballot. You know, we've also seen changes in the demands from the state. Counties are branches of the state government, and health services are one of those areas of required services. In 2008, the state passed a new Board of Health and Health Care requirements, and they go beyond this kind of traditional clinical care delivery. We've always had community health up at the Health and Human Service buildings off of Castle Creek Road that do sexual transmitted disease screening, reproductive health, family screening, things like this, some basic clinical services, but we're now required to look after what is called population health. And so that can be a much greater variety of things, everything from the prevention of drug and substance abuse, assisting with mental health issues, avoiding domestic violence, and trying to keep families whole and healthy from the start, rather than the larger kind of federally mandated interventions, which are child custody, protective services, potentially removing kids from homes, adult protective services, issues like that. The funding goes to our senior center as well, and supports a great number of services there, as all of Colorado is experiencing a dramatic increase in our senior population, like it or not, for many of us. But that's a very, very important aging in place and aging well for our community members. So the various nonprofits that are also a part of this funding are going a long way towards dealing with the issues the community has brought to us. Again, particularly suicide prevention, mental health, substance abuse, healthy families and communities across the board. This is part of our network of care, from infants with visiting nurses program, helping new young parents deal with those stresses, all the way up through hospice care, which many of our friends have benefited from, and their families during those trying times.
Steve, wouldn't homeowners think, I don't want my taxes to just be given to this general fund, and then I have no control where that goes after that. There's 70 nonprofits that this goes to. How about I just choose where I'm going to put my money directly instead of being forced to be taxed on this?
Right. I hear that question a lot. And so I am one of 8 members of the Citizen Review Committee, including 2 high school students, by the way. And I think Rachel made a very compelling case for why we need this money. So let me answer your question as to how it's managed. Because as a taxpayer, I actually pay twice. I pay because I own a home in Pitkin County. I also own a business in Pitkin County. So I take it very seriously how this money is spent. And frankly, when I first came on the review committee 4 years ago, I had conflicted feelings. Like you just asked, I would say to myself, why shouldn't I just contribute on my own? Well, I've got 3 responses to that because I've just finished reviewing 70 grant requests last week. And by the way, we review them carefully. We read them from start to finish. And here are the 3 observations I'd like to give other taxpayers. Number 1, this grant process forces nonprofits to act more like businesses. We require balance sheets, income statements for 2 years. We require a budget for the coming year. We require a list of other donors so that we know that Healthy Community Fund isn't the only donor. And I don't know about you, but the only time I really get my books together is when I'm going for a loan or I'm paying my taxes. I think the application process for the Healthy Community Fund forces nonprofits to act more like businesses, and that's a good thing. The second thing that I'd like to say that maybe a little controversial is, as a result of being on this committee, I'm convinced we do not have too many nonprofits in this valley. I've heard that stated before. We have more nonprofits than any other, geographic area in the country. Well, the metaphor I use is a forest. Our nonprofit community has diversity. We have large nonprofits serving hundreds of people, thousands of people. We have small nonprofits who maybe fill quite a small niche, but nonetheless, to those people they're serving, that's very important. And I like diversity. By the way, I like all these human services being managed by nonprofit organizations and not our government. As much as I love our county government, our city government, they have plenty to do. I would not want to see a giant fund administered by the county, for example. I like the fact that we spread this money around nonprofits. Which brings me to my third observation, and that is, I actually feel like I'm helping manage a venture fund. Yes, we give away $3 million a year, but that $3 million actually results in $60 million worth of transactions at the nonprofits. So our $3 million generates $60 million worth of activity. It creates hundreds of volunteer board members from our community who serve on these boards. Each one of these nonprofits is out there pleading their case. They're building lists of thousands of donors. This is a highly leveraged fund.
Yeah, just to add to that a moment, these groups will use the Pitkin County imprimatur when they're applying for other grants from the state, feds, foundations, or other individuals. So it's really an important tool for them to, because that's the first question a reviewer will ask is, well, what's your local support like? And this is our local support for these. And there's a certain synergy, I think, that goes forward. If you just say, okay, let's just see who's the most glamorous or who has the most star power to attract donations, it may not be so much where the greatest need is. And this is an ability to make sure the resources are going to current needs and can be readjusted as situations occur.
Let's stay on that, Rachel. What promise is there in this ballot measure to the voters about where this money will get spent and who decides it? A couple years ago, that money got transferred a little bit where and how it's being spent. The Hope Center was upset that they weren't going to get what they thought was their portion of the Healthy Community Fund as a new kind of collective came together, and people were upset about that. You can address that a little bit, or what I'm really going for is where do we know this money will be used if we say yes to it?
Okay. Well, the Board of County Commissioners will be going into its budget hearings and hearing the results of the Healthy Community Funds Review Board and their recommendations this fall. But you can look at the 2017 records to know exactly where every dime went and how it was spent and what the mission of those organizations were. So that's very clear. It's public record. It's all accounted for. I believe your meetings are actually public if people wanted to attend those evenings of review, and then they're presented to the board and filmed by Grassroots. So it's all very upfront. And we do have professional staff who visit throughout the year to assure that those dollars are being spent for their intended purpose. Those organizations turn their budgets back in the following year and have to be accountable for them. There were issues last year as we tried to deal with the mental health issue better. And there was a request for proposals that was put out, and a number of organizations participated and some did not, and thought that they would try to stand alone. I believe most of those issues have been worked out through this year, and we did contribute to the Hope Center as well separately. As my suggestion, frankly, because I wanted to make sure we had a smooth transition. But that proposal was for much more than just suicide prevention, suicide response. It was so that we could have mental health officers in the schools and a much bigger, broader program that involved response when the police come to any sort of difficult situation, maybe not a suicide, but something where someone's dealing with mental health. And so there were far more agencies and far more collaboration brought together, and we're happy to work with the Hope Center as part of that collaboration.
Finally, I want to pull back a little bit. This is called the Healthy Communities Fund. So I want the assessment of how healthy is our community. I think one thing that you might come up across is when someone sees that on their ballot, do I want to spend money on making us healthy? Well, we're the most healthy community in Colorado. Why would I pay to make us even healthier? What is the state of our community right now?
Well, I can give you a few. We have a dramatically growing senior population like the rest of the state. We have about 10% of our population Medicaid enrolled, although certainly more are eligible. We have a lot of low-income jobs, and we have a large commuting workforce that can create tremendous stress, latchkey kids, people away from home a lot, troubles making rent. I think most people in our community are what they call rent burdened when you're paying far more than 30% of your income. You know, you keep things healthy. You invest in things. The Roaring Fork Outdoor Volunteers are beneficiaries. Healthy Rivers, Roaring Fork Conservancy for some of their studies. Groups like the Aspen Ski Club. A lot of the groups that you may participate in a little bit, you don't realize are beneficiaries of this fund.
I'd like to add to that, though, because I think what you're asking is what metrics do we have for how healthy our town is. You can ask some people and they say we're the healthiest town in the state. You can ask other people and they say, oh, there's trouble in River City. As we review these grants, we ask for metrics.
Okay.
What are you measuring and how are you doing this year compared to last year?
Yeah.
What do those look like?
Some are getting better, some are getting worse. But the point is, by asking them to actually measure their impact, that's a good thing. Don't tell me how many people you serve, don't tell me how many people came to your benefit dinner. Tell me the metrics.
Yeah. Steve Wickes serves on the Citizen Review Committee for the Healthy Community Fund. Rachel Richards is a Pitkin County Commissioner. They're speaking about Pitkin County Ballot Measure 1A, which is a dedicated property tax for the Healthy Community Fund. I'm Alycin Bektesh. Thanks for tuning in.